Hello viewers and welcome to another program called Talk to the Camera with me, Syl Akempta. Today we get forget Dr Mustapha Kabba, who is the Deputy Chief Medical Officer of the Clinical Department at the Ministry of Health and Sanitation. Now he tell me as we don't monitor as how the mobile health clinic they move, as we don't cover 2 times wey dem dey go na the provinces. So today we come for can get himself. Now he tell me how this operation dey go and wetin are the challenges, wetin are the success stories, and most people like in target per day. So stay with me as we will get an interview with her now. So good morning and welcome to this interview. Please introduce yourself to viewers.
Good morning, me na Dr Mustapha Kabba. Me na the Deputy Chief Medical Officer, Clinical Services, Ministry of Health and Sanitation.
Also, we work you right now, go and you explain to them small within the clinical service they are all about is that the Ministry of Health and Sanitation.
Well, this na the unit or the part of the Ministry of Health and Sanitation. We're responsible for hospital services. We make sure so we go to hospital everything for the day. The doctor then for day on call where they do their duties. And if also get the required infrastructure for the doctors and for do their work. Also the clinical services, they look at also the ambulance services, the blood services. You also encompass the holistic clinical care of any patient we can at the hospital. Of course, I've been annotated in this position. But since we don't come, we make tangible efforts working with partners and the government of Sierra Leone for make sure we improve on the services for patients and again at the hospital.
Can you tell me small about the partners they want to work with?
Well, we get partners, of course. One of the main partners is the WHO. We get UNICEF. We get Global Fund. We get Gavi. We don't come in now. We get, of course, locally PIH also. We get King's Partnership. We get so many partners. We get Red Cross Society. We get ISPRO. There are so many of them. We definitely they work in the health sector for make sure we move well body business go before together.
So now we talk small as we don't witness, talk to the camera and don't witness the mobile health clinic as they don't go to 10 now at the provinces. So I need to give people a small synopsis about how that process is done.
Well, the mobile health clinic don't go, now the third mission then goes to this last time. And the mobile health hospital on wheels, how they call them now, 4 buses where the Chinese government donate to the people of Sierra Leone based on a request where His Excellency the President make get services to them people then we not able get opportunity for going to hospital where the remote area there. So the Chinese government begin this bus system, and ever since these buses were launched, we don't get a program and a strategy for to go out into districts, work with community them, recruit patients them and see them, and the treatments are free. They provide a range of services. The buses then they do screening for hypertension, then they take care of patients with diabetes, then they take care of the old people them, young people them, belly woman them, and they screen them. Then they provide treatment of course for all the basic common diseases like malaria in the country. And the buses then the advantage we then get is that they also get laboratory facilities, meaning where you go there, they just see no more than check you, but then they also do test them. We have good equipped labs. Then get all the equipments then for looking at years, look at EI, Then get the facility also on board for the ECG, for check how your heart the beat. If they don't treat, the doctor there or the nurse they don't see you, then come up with a diagnosis, something we need for be treated. Drugs are also there on board the bus. So the bus they provide free drugs. And waiting at the advantage of also of this bus there is that this time the bus they go no more for provide treatment, but they do prevention in the form of vaccination. So vaccination services are on board. We get COVID-19 vaccine, we get even this human papilloma virus vaccine for them, for the young girl them, All of that the activities where the boss then they do, and also they do health talks. People then they educate them on behavioral change, how to deal with certain diseases, or how to do so that you don't even get some of them sickness then. So the busing concept, it would go on all districts and go get the facility for city bus. The only challenge sometimes is the bus is so sensitive. They only go in areas where I get quota. So we say quota no day because of the shake and the equipment on board. We'll not go beyond the day, but we'll go to the nearest point close to the point to say the quota the stop, so that the people then will get access to the services on board and bus there.
Now, no talk small about the challenges that we don't face since we start this hospital on wheels, the mobile health clinic. I want to tell viewers that when they watch you right now, some of the challenges they don't face, but make sure so we put all this together.
Well, some of the challenges are the influx of patients, because now open thing, it's difficult for control whether they can, whether not they can. So we can go to a district to say, okay, we expect 200, but at the end of the day, you can get 500 people. So with staff, we are mostly thanks to very dedicated staff of doctors, nurses, community health workers, and laboratory technicians, and even the driver them, where they drive them bus. They do a perfect job and they are well trained for move. They can work even extra time. Then they go beyond the normal time. Sometimes they can dinner the sites up to 10 o'clock in the night, you know. And some areas they not get adequate electricity. So these are some of the challenges that we can get where they go on the field.
Now we talk small because plenty people in Salon can say continuity is a challenge. As we don't do this news, plenty people can comment say they hope say this kind of venture with the Ministry of Health they take so for continuity. So going forward, what is Sierra Leoneans would expect from them?
Well, this mission, now the first time this country don't ever get this kind of activity in the country, right? Where the government self they go out and take buses or give free treatment to people over a long period of time. So we're on the pilot phase. We of course the sustainability of these buses is really a concern for us and the whole project. So what do we think about now is that how we go able to integrate them into the national health system we get in the country. So you not stand alone, like for say okay we'll get clinic, we'll go, but if we'll be integrated into the national health structure with proper programming, proper planning, proper leadership structure under proper directors, and if will be used as a tool for enable some other services the way the government they provide. For example, the buses can be expanded in a form where you go roll out vaccination with them extensively all over the country. If you say I don't get a new vaccine I want for roll out, you roll out, you go to all the communities, you get different units. And the bus not just one big unit. It can be the mother units, they get smaller units. You can get like Land Cruisers, you can get like keke, you can get bike, you can get, you know, so the worst case, if you say person not able to go bike self, you can able get that backpack where you go out and move out and give the people any required treatment. So there is a plan. We need to think about how do we properly integrate it into the national health system so that it's sustainable.
Before we end this interview, how much people on the targets per day?
Well, usually it depends on the site and the location, but usually with the target between 300 to 500 people per day, where they can go on sites, you know. And then sometimes they can in one site for 5 days, sometimes they can in some districts for 6 or 7 days, depending on the population where the district they present to we.
The feedbacks they can give, are they positive or negative feedbacks where the people who want to get it, what they can give?
Well, the feedback is excellent. It's really good to be a Sierra Leonean at this time. This kind of positive thing where they happen, where you see say people then where some of them know one day go to hospital, then get access to a well-equipped hospital where they can meet them at their communities. And all the services are free. They need pay for nothing. The only thing we get for do for consider the patient, you wait till your time come, the doctor then treat. And when the doctor then see you, then they will refer you to other facilities. If not something we're very difficult and complex, then they refer you to the nearest health facility, a hospital, for further management. So the feedback we get from this community is that the people that want more of this for to happen, they are so happy that it happened to them, and then grateful to the government where they provide the service for them.
So what will be last word to viewers?
Well, my last word to viewers is that this Ministry of Health and Sanitation in the government is a caring one, and the activity where they roll out is for the people of Sierra Leone. So may everybody make use of this opportunity and come out in your numbers and participate in the mobile health clinic activities, and make sure that whenever you're in at the site, comport yourself, behave yourself, wait time come, you definitely get the services we do on board the buses.
Thank you very much.
You're welcome. Thank you.
Viewers, you said don't listen waiting. Doctor don't tell you, as he say, for put this together not to an easy task, and they get positive response from the people who already treat, and also for not this continue themselves the plead to the people we can support them, the partners, and also the government of Sierra Leone, because this is an initiative way go better. Plenty Sierra Leoneans now the country will not get the upper hand for sick medication. Me na Syl Akempta, and this na talk to the camera. Tata.